Thanks for watching. It's a great day for Democrats, for the President of the United States, Barack Obama, and for all Americans who rely on fair and affordable health care in this country. Now, the Supreme Court voted to uphold the individual mandate in the Affordable Care Act. The decision leaves the president's signature legislative achievement almost completely intact. The controlling opinion was written by Chief Justice John Roberts, which surprised a lot of folks. Roberts broke away from the court conservatives to side with the Obama administration in declaring the law constitutional. The ruling gives President Obama a chance to restate and reset the table when it comes to health care in this country. He explained today what the law does for a vast majority of Americans.
Today's decision was a victory for people all over this country, whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. And because this law has a direct impact on so many Americans, I want to take this opportunity to talk about exactly what it means for you. First, if you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Insurance companies can no longer impose lifetime limits on the amount of care you receive. They can no longer discriminate against children with pre-existing conditions. They can no longer drop your coverage if you get sick. They can no longer jack up your premiums without reason. They are required to provide free preventive care like checkups and mammograms, a provision that's already helped 54 million Americans with private insurance. And by this August, nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your health care. There's more. Because of the Affordable Care Act, young adults under the age of 26 are able to stay on their parents' health care plans, a provision that's already helped 6 million young Americans. And because of the Affordable Care Act, seniors receive a discount on their prescription drugs, a discount that's already saved more than 5 million seniors on Medicare about $600 each.
Health care reform in America is most important for the millions who cannot afford the high cost of private insurance. The president told those Americans what they can rely on as this law is fully implemented.
If you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from. If you're sick, you'll finally have the same chance to get quality, affordable health care as everyone else. And if you can't afford the premiums, you'll receive a credit that helps pay for it.
President Obama closed his remarks today with a story about one person's struggle with the previous health care system.
There's a framed letter that hangs in my office right now. It was sent to me during the health care debate by a woman named Natoma Canfield. For years and years, Natoma did everything right. She bought health insurance, she paid her premiums on time, but 18 years ago, Natoma was diagnosed with cancer. And even though she'd been cancer-free for more than a decade, her insurance company kept jacking up her rates year after year. And despite her desire to keep her coverage, despite her fears that she would get sick again, she had to surrender her health insurance and was forced to hang her fortunes on chance. Natoma is well today, and because of this law, there are other Americans, other sons and daughters, brothers and sisters, fathers and mothers, who will not have to hang their fortunes on chance. These are the Americans for whom we passed this law.
And we are told the president called that lady tonight to congratulate her. The court decision marks an end to the second major battle over health care reform. Republicans are determined to have a third battle. Their only recourse is to tell the American people that they will repeal the law. Mitt Romney said the court's decision was wrong, and he will dedicate his presidency to fighting it.
What the court did not do on its last day in session, I will do on my first day if elected president of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy.
Well, Mitt Romney needs to get with the program. It's not the job of the Supreme Court to decide whether a law is good policy. The Supreme Court decides whether a law is valid by the letter of the United States Constitution. There is no more debate over the Affordable Care Act. It is constitutional. This is a day of vindication in many respects. Every Democratic president since Franklin Roosevelt had health care reform on their agenda. There's a feeling among the Democrats here in Washington that they have really accomplished something that is going to be great for generations to come. As Joe Biden said, leaving out the F word, this really is a big deal. Get your cell phones out. I want to know what you think tonight. Tonight's question: did the Supreme Court make the right decision? Text A for yes, text B for no to 622-639. You can always go to our blog at ed.msnbc.com. We'll bring you the results later on in the show. I'm joined tonight by the senior Democrat on the House Education and Workforce Committee, George Miller of California, and Howard Dean, former governor of Vermont and former chairman of the DNC. Gentlemen, great to have you with us tonight. Congressman, let me start with you. I believe it, if I have my numbers right, it was 38 years ago you were elected to Congress.
That's right.
You wanted to stop the war in Vietnam and you wanted to get health care. This has been a long haul for you.
It's been a long haul.
You got to feel great.
I feel great. It's a very, very exciting day for the American people. Just think they have access to affordable health care that cannot be taken away. And they control their health care decisions now, not the insurance company.
What does this mean? Does this mean there's more to come? Does this set the table?
Well, we know this sets the table in terms of the benefits that the president outlined that cut through the entire American society, people benefiting from this, including small businesses that are getting the tax credits. But we know there's more to come because there's more to come from the Republicans who have now decided they will launch a legislative assault against what happened today, where for the first time in the history of this country, Americans have health care that they can't be taken away, that's affordable, and they get all of the additional benefits of reduced costs for prescription drugs and for wellness care, for mammograms, all the things that are important to families.
I went to the Republican briefing on the Hill today. They're calling it a job killer. They're saying it's terrible for small business. You didn't say that.
Well, the fact is that we have about 300,000 small businesses and 2 million of their employees that have gotten health care since this became the law because they get credits to help them pay for that health care. These small business people want to offer health care. They couldn't afford it because of the nature of their business.
Now they can.
Now they can, and they're doing it.
Governor Dean, we know one thing about the Republicans. They don't give up. And the next 4 months are going to be politically brutal. First of all, your response to the ruling today, I know you're not a fan of the mandate, your response to the ruling and your coaching, so to speak, on how the Democrats have got to sell this the next 4 months and run on it.
Well, first of all, this was a great ruling, not the least because John Roberts they're going to have a hard time calling John Roberts a socialist, even on Fox News. Secondly, Governor Romney, if Governor Romney hadn't been governor of Massachusetts, we wouldn't be seeing this bill because he pioneered the bill. As for him to criticize it is just ludicrous. Thirdly, George is right. There's a lot of good things. I wasn't a big fan of the bill. I thought the House did a great job in this bill. I wasn't a fan of the bill as it came out of the Senate. But there are a lot of good things in this bill that are going to make a big difference to people. I'm a little nervous about the Medicaid ruling because Medicaid is actually insured more people in this bill than anything else. And I want to take a look and see if that got undermined by the reservations that Judge Justice Roberts had. But in general, this is a great day for the president, and it's a great day for all the people who worked hard to do this. This is not the way I would have done it, but this is a universal system. Other countries use this kind of a universal system, and it's about time America joined the rest of the industrialized democracies in the world.
Governor Dean, should Democrats run on this? I mean, should they go home and say, this is what we've accomplished, the Supreme Court's with us, and let's move forward? Is that a good play for the Democrats?
They can, Ed, but the truth is the Republicans are doing this to whip up their base. They're not doing this because swing voters swing voters like what's in this bill. They do. They don't like the mandate, but they do like the benefits for their kids, for their parents, their ability to move their insurance if they lose their job. I mean, one of the terrifying things about losing your job when you're 55 is you'll never get insurance again. Well, now you will because of Barack Obama and the Congress, the Democrats in Congress of the United States. So, this election is going to be on the economy, and it's whether people trust Mitt Romney to represent their interests, which they overwhelmingly do not because they know he's for the 1%. I think this is a great day for the Democrats, and they've earned it.
Mitt Romney made a lot of misleading statements about the law today in his statement. Here it is.
Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations. Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep. Obamacare is a job killer.
Congressman, it's like it's two different worlds.
It is two different worlds.
I mean, is he lying to the American people?
He's misleading the American people. He's lying to the American people because that's not what it does. He knows that the Congressional Budget Office says that this saves over $1 trillion in reducing health care costs over the coming years. It's the beginning of the reduction of health care costs. The fact of the matter is we see small businesses expanding their businesses, providing health care to their employees because they get some assistance through the job credits. Mm-hmm. And remember this, something else goes along with this health care coverage that can never be taken away. Economic security. You know how many millions of Americans in this recession lost their health care because they lost their job? Not because they weren't good workers. It's because of those scandals on Wall Street. They lost their jobs, then they lost their health care, and then they ended up in bankruptcy court. That doesn't happen to people in the future. And for people who want to start a business but worry about leaving the company they're with because their wife and their spouse, if you will, and a child, they can now be entrepreneurial. Mm-hmm. They can start business. This is economic security and economic growth for this nation because health care was going up 16% a year before we ever talked about introducing this bill. Companies were coming in all of the time and saying, I'm going to drop my health care, I'm going to drop my health care, I'm going to drop my health care.
Governor Dean, I want to ask you about how you think the Romney campaign is going to play this going forward. I made the comment earlier today, and I believe this. I mean, I think it's going to be easier for him because now he doesn't have to come up with a health care plan. All he's got to do is run against Obamacare, as he calls it.
Yeah, but the problem is what the court has given its imprimatur to this. That matters to Americans. It's true that the court has its low ratings and all that because they're so political. But when you get a court, especially led by a conservative, who everybody knows is a conservative, who supports this, that gives Obama some cover. This bill is also going to have some unintended consequences, most of which are good. For example, the Democrats don't like me to say this, but it is true that small businesses in droves are going to put their people out of their own insurance and into the exchanges. That's going to be great for the small businesses, and it's going to be good for the employees who are now going to have insurance that doesn't depend on their employment. So even some of the things that weren't intended in this bill are going to be very good. The ACOs, which is a very complicated thing we don't have to get into, is probably going to end up reforming the way we pay for health care and turning this into a wellness system instead of an illness system. So there's a lot of stuff in this bill that is going to work out very, very well. There's some things, the expenses are going to have to be dealt with down the road, but this is a big step forward.
And we should point out that the Medicare expansion is going to be paid for with federal funds the first 3 years, 100%.
Yes,
Medicaid.
My guess is, and I'd like to hear what George says about this, because this is a critical piece, and I think the Congress is going to have to deal with that. That's the one thing I worry about.
The Medicaid expansion, 100% paid for first 3 years.
First 3 years, and then it goes down to 90% over it goes 97, 94, 90.
So how are Republican governors going to say no to that money?
I don't think they are. This is the highest reimbursement level, participation or cost sharing that they've had from the federal government in history. Yeah. And I think very clearly that this is very helpful to the governors getting these people covered, because otherwise these unreimbursed costs are laid off onto the state taxpayer or to the hospitals and their users or to the insured. So this is very helpful to the governors. I know philosophically a handful won't like it. Yeah. They'll be showing up to ask for the
Well, I know both of you gentlemen have dedicated your careers to doing something about health care in this country, and something really got done today. Congressman George Miller and Howard Dean, great to have you with us tonight here on The Ed Show. Thanks so much. Remember to answer tonight's question there at the bottom of the screen. Share your thoughts on Twitter at Ed Show. We want to know what you think. Up next, my exclusive interview with Nancy Pelosi, who takes a real whack at Mitt Romney. Stay with us.